not be complacent with some colleagues who will tell you, I have been here for such and such years.
To be educated, but I'm so frustrated. Hello to my loneliness.
Hello everyone, welcome to Caring Heart. I'm Bernice Odudu, a certified nurse educator and a certified medical surgical registered nurse. I help new graduates and immigrant nurses to build confidence, overcome cultural shock in the job, and advance their career. At Caring Heart, nurses learn the strategies to navigate the complexities of the healthcare system and break the barriers which limit them from succeeding. Valuable practical tips not taught in classrooms are explored weekly to empower nurses in their quest for professional growth. More so, I offer them free. Whether you are a new or seasoned nurse, you will certainly find some of the content useful. I encourage you to subscribe and share to help other nurses still struggling with the challenges in today's healthcare system. Episode 18. How a nurse can optimize critical thinking skills. 10 tips to consider. Today, we embark on a journey to enlighten our mind, deepen our thoughts, and explore the world of critical thinking. As a nurse, critical thinking is an essential skill for effective and quality nursing care, for better patient outcome and patient satisfaction. It empowers the nurse to make informed and evidence-based decisions that impact the lives of our patients. Let us dive into the 10 tips to help a nurse optimize critical thinking skills. 1. Make sure that you are always keeping your expertise up to date by keeping up with the most recent evidence-based practices, medical developments, and nursing research. Maintain a consistent schedule of professional development activities, such as attending professional conferences, reading materials pertinent to your field, and taking part in continuing education and courses. I attend at least one nursing professional conference every year. Attending conferences have helped my professional growth and build my self-confidence in embarking on this journey with you. The vast amount of knowledge acquired in conferences and reading professional magazines and materials have truly empowered me. I highly encourage you to do the same. 2. Perform in-depth analysis and ask pertinent questions. Try not to accept facts at face value and instead challenge any preconceptions you might have. Create a routine out of conducting in-depth analysis of data, research findings, and information about patients, processes, and equipment to keep a better knowledge and guarantee that decisions are made correctly. It is important to ask questions that probe deeper. Questions like, why am I doing this? What is the benefit of doing it? How can I do it better? Is there any evidence-based practice which support this process? Searching for the answers to these questions will open up new ideas. Do not be complacent with some colleagues who will tell you, I have been here for such and such years. This is how it's been done. Nothing ever changes here. 3. Look for other points of view. Embrace a variety of viewpoints and make it a point to solicit ideas from team members who come from a range of disciplines. Work together with the patient's doctors, pharmacists, therapists, and any other medical expert who are involved in the treatment to achieve a holistic understanding of the patient's condition. Listen to your patient, some might have some new knowledge which you may benefit from. For example, a nurse caring for a patient on peritoneal dialysis may be unfamiliar with the access tube and cap. Asking the patient to tell you more how he or she performs the procedure at home will be helpful and serve as added new knowledge for the nurse. Remember These patients have been taught and are used to the dialysis equipment. Keep in mind, sometimes patients gather a lot of information during their doctor's visit from friends and family members and personal experiences of the health condition, which may be totally new to you as a nurse. 4. Improve your critical thinking by working on your ability to make connections between pertinent pieces of information and arrive at conclusions that make sense. You should make it a habit to use the nursing process, assessment, diagnosis, planning, implementation, and evaluation to direct your thinking and decision making, which will ultimately result in a more effective and efficient patient care. When you do this in a consistent basis, it will become a natural habit. 5. Employ strategies for problem solving. When you are confronted with problems or complex patient scenarios, employ strategies for problem solving, such as brainstorming, critical questioning, and root cause analysis. You will be able to discover fundamental problems and efficiently fix them with the help of these tactics. 6. Encourage successful communication. Robust communication skills are vital components of critical thinking. Participate in active listening, inquire about anything that isn't obvious, and communicate information in a direct manner. You'll be able to maintain more accurate information and work more efficiently if you communicate effectively with patients, their family, and your colleagues. 7. Create a situational awareness. Pay attention to your surroundings and create a heightened awareness of the patient's condition as well as the place which they are being treated in the healthcare setting. For the purpose of preventing bad occurrences and ensuring the safety of self, patients, colleagues, it is important to maintain vigilance, consider possible dangers, and recognize early warning indications. Pay attention to details. There was an incident a nurse shared with me. Per the nurse, a colleague was assigned to watch a patient who was placed on restraint for pulling off tubes. At a time during the shift, the patient became calm and docile. The nurse watching the patient, however, was happy that the patient had finally quieted down. When it was time to administer scheduled medication, the patient was observed to be stiff and unalive. According to the nurse, the staff on duty were shocked. The investigations and corrective actions which followed that incident was a nightmare for all the staff. It is therefore important to pay attention, check on your patients frequently, and question signs and follow your instinct. 8. Give patient-centered care top priority. When making decisions, the needs and preference of the patient should always take precedence over other considerations. To deliver care that is both individualized and holistic, you need to factor in patients' values, the cultural context in which they were raised, and their specific circumstances. This is very important. Be culturally competent. Avoid being judgmental. Your role is to utilize the code of conduct and organizational policies as a guide for the information and care you provide. 9. Embrace the practice of continual reflection. At regular intervals, think about your experiences, clinical judgments, and the results of patient care. Conduct an evaluation of the efficacy of your treatments. Pinpoint any areas in which they could be improved and adapt your working methods accordingly. To further hone your capacity for critical thinking, solicit the feedback of your peers and make time for self-reflection. Reflection is a very important piece for self-growth. Practice a habit of taking 5 to 10 minutes to reflect and review the high priority tasks scheduled for your shift before leaving the unit. 10. Develop a growth mindset by adopting a philosophy of learning that emphasizes ongoing education and keeping an open mind to new information and experiences. Encourage others to provide you with feedback. Take responsibility of your own mistakes and view obstacles as chances for personal development. Participating in professional groups, being open to new technology, and having in-depth conversation about specific cases are excellent ways to continue developing your critical thinking skills. If you practice these tips, you will develop into a nurse who is able to navigate difficult circumstances, advocate for your patients, and provide care that is tailored to meet their individual requirements. Practice working on improving your critical skills. Keep in mind that critical thinking is a talent that can be developed over time with practice. So have patience with yourself and keep pushing yourself to provide excellent care to your patient. Thank you for watching. Please don't forget to subscribe and share by activating the subscription button. You can leave your comments, and for more information you can reach me via the email on the screen. Remember, a caring heart makes a difference.